Hi, my name is Darleen Lamm, and today I'm going to talk to you about attention deficit hyperactivity disorder, better known as ADHD. It is the most common neurobehavioral disorder found in children today. It affects 8 to 10% of our school children. It can hinder their academic achievement, their social interactions, and also their well-being. So today I'm going to briefly introduce you to the symptoms of ADHD, the diagnosis, the remedies, and then do a quick overview of the ADHD brain. But before I do, I'd like to introduce you to a few famous people. You just might know them and they also share this ADHD diagnosis. We've got John F. Kennedy, Abraham Lincoln, our inventors Thomas Edison and Albert Einstein, and the Wright brothers. And then there's also actors Jim Carrey and Will Smith. Now, how many of you would have thought that these very accomplished people have ADHD? Now, the causes of ADHD is usually that it's genetic. But they also believe that if you smoke, drink, or do drugs during pregnancy, you could have an ADHD child. They also believe that environmental toxins such as lead could cause ADHD, as well as food preservatives, food additives, and food colorings with a concentration on red and yellow colorings. Now there's 3 categories of ADHD, and with some behaviors in one category that are combined, and the combination is inattentive and hyperactive impulse behavior. The inattentive symptoms are: does not listen, they have difficulty organizing, they're forgetful and easily distracted, with no follow-through on instructions, they fail to pay close attention to details, and they lose things frequently. The hyperactive and impulse is they fidget in their seat, they leave their seats when inappropriate, they have difficulty awaiting their turn, they talk excessively, and they blurt out answers. Now, one mother I know, when she described her ADHD child, she said, when he walks in, so does confusion. Also remember that most healthy children can be inattentive and hyperactive from time to time, but it's when it lasts for 6 months or more, or they start having trouble in school, that you need to go see a healthcare professional. Many people want to blame parents for the ADHD behavior because they think that they don't discipline their children correctly, but poor parenting does not cause ADHD. And the children aren't bad. The children just need a little help on learning how to control their behaviors. Now, we'll talk about that in just a minute. Now, right now, we've talked about what ADHD is, the causes, and the categories, so I want to give you a brief overview of the ADHD brain. The ADHD brain is 5 to 10% smaller in size and activity. It has abnormal functionings of certain neurotransmitters. The chemicals are, the 2 main ones are norepinephrine and dopamine. Now these are critical in regulating mood and behavior. Norepinephrine regulates emotions, mood, and the blood pressure, and it's believed to be higher in children with ADHD. Dopamine helps to regulate mood and is found to be lower in ADHD children. Also, brain scans have shown that the frontal lobes of the ADHD child have a lower blood flow. Now this frontal lobe, they control the higher cognitive tasks of the brain, so it's called the executive brain. When these chemicals are out of balance, the children have difficulty planning, organizing, developing, or even completing a task. So the way to handle that is to give them medications. And they balance the medications, help to raise the dopamine and lower the norepinephrine. Now, ADHD has no cures, only treatments. It's found, usually diagnosed in the early years of childhood. And so if you go to a medical professional and they do an evaluation, which they do say are non-conclusive, you might get a diagnosis of ADHD. But along with ADHD, you can have other conditions such as oppositional defiant disorder, anxiety disorder, mood disorder, Tourette's, or even learning disease. They can all coexist together. Now each disease has their own set of challenges, but with medication and behavioral therapy, you can usually live a successful life. ADHD children are not doomed to a life of disorder or chaos. They just need to have their medications, a regular schedule, their directives need to be limited, and they need to get rest, and they can live a very healthy life. Now, I've just given you a very large amount of information in a very short time, but I hope you feel informed about the symptoms, diagnosis, remedies, and the brain function of the ADHD child. If you'd like to learn more, there is an enormous amount of information online. You can go to your public library, or you can even find periodicals such as this that tell you all about ADHD and give you hints and tips on how to handle it. Thank you.